Okay, hi, I'm Brooke, training manager with Incorporate Massage. Today we're going to do a tutorial for Lordosis, Kyphosis, and Scoliosis in chair massage. When we're working with people in the chair, obviously we have full access to their spines, so this is an amazing technique that I feel I get more results from with people sitting in chairs and lying on tables. So let's begin. The first one I'm going to talk about is the Kyphotic Posture, and that's classically up here in the Thoracics. Kyphotic Posture in the upper Thoracics comes from a lot of people sitting at their desks, hunching over, cooks at a table, anything where anyone's doing something like this. And you know what? Massage therapists were not free from this either. So the intervention that you want to do to relieve stress and pain in these upper thoracics is really just anything you can do to gather the spine tissue and bring it in towards the spine. We want to gather those erector spinae groups into the spine to help support it. That's the idea behind it. So you can do pretty much any technique that you feel comfortable with. You can do an elbow where you gather and you press inward. Now the one thing that you want to be really careful about here is you're working around some pretty bony structures, so the scapula, the spine, and so you don't want to put a very sharp tool such as a point of your elbow or a knuckle or something right on the bone. So using a very broad tool I find is best. So I'm just scooping and gathering all the tissue and just squishing it right into the spine, and you just do that on both sides. Switch arms to keep your body mechanics good. And you're just scooping and gathering and bringing all that tissue into the spine. Okay? So after you've done that, the next intervention to do would be to call for some movement. I'm a Rolfer, so I quote Ida Rolf. Ida Rolf says, put it where it needs to go and make it move, right? So not using a ton of pressure on your thumbs because you want to protect your thumb joints. You need to call for some movement from your client, especially if you're trying to change the structure, right? So I get my thumbs right at the erector spinae, right off the medial border of the scapula. I squish it into the spine, and then I tell my client to take a breath in and lift their head up off the face rest. Just that much is good, and back down again. So as soon as you feel that spine flex a little bit, that's when you say that's good. So, and then just have them do that back and forth with their breath. So inhale, lift your face up. Exhale, rest back down. And you just move your thumbs up and down that hump with their breath. Back down. And I like to go all the way up to the neck. And make sure you go from the medial border all the way up the neck. So just climbing all the way up as they just breathe and move their face off the face rest, cradle, and back down. So that is a very simple dowagers, I'm not saying that right, hump or kyphotic curvature to the upper thoracics. But that intervention can be done even if it's lower. So if it was a lower kyphotic curve, which you don't see very often, but I've seen it, you would have the client arch their lower back. So you would gather the tissue into the spine and then just have them tuck their tailbone under, arch their back means tuck their tailbone out or bring their tailbone out. Another thing you can say is press your belly button into the chair, if that's easier. So with their breath, press your belly button into your chair, and then that will create a subtle arch in the spine as you're just pressing that meat into the spine. Okay? All right, so opposite of that is lordosis. Lordosis can happen, again, anywhere, upper or lower. Most commonly, it's in the lumbars. So for a lordotic, just opposite of kyphotic. Instead of bringing the tissue into the spine, you're going to navigate the tissue away. So the concept behind this is you want to dig a hole where the spine can come back into, right? So I would just get down into the proposal position here, and I'm moving my arm this way, so my hara is pointing the way that I want to move the tissue so that you're not straining your shoulder. So I've got my arm in the lumbar crease right at the QL area, and I'm not doing too much, I'm not giving too much pressure. This is just an oblique angle, not directly in, it's out this way. So I'm just gathering the tissue and spreading it this way. So now when you want to call for movement, this is where you would want them to tuck their tailbone under, okay? So tucking their tailbone under, or press your belly button into your spine with your exhale. So on your next exhale, Russ, go ahead and press your belly button into your spine, and you just feel that flexion, and then you just gather it that way. Just on your next exhale, just keep doing that with every exhale. And then you would do that maybe 3 times, 4 times, depending on how much time you have for the session. Switch your knee, and then go to the opposite side. Remember to point your hara or your belly in the direction where you want to move. Move from the hips, and then cue your client. And just move that way. Okay? Now that is a really good intervention for people who have the lordotic curve, but also the herniated discs, so long as they say it's okay for you to work on it. If they do have a herniated disc in their lower back, the best position for your client is to have their feet flat on the floor rather than in the stirrups here. So when their feet are flat on the floor, they can actually press into the floor to press their spine into you rather than using their spine. That would be something you would do if somebody's actually injured here, okay? All right, so moving on to scoliosis. This is where we get fun. Since Russ doesn't have scoliosis, I get to make him a scoliotic hump. Okay, so classic scoliosis is the spine, right? That's our spine, but a scoliotic, whoop, I think it actually goes more like that, right? And then possibly like that. Okay, so that is an example of what a scoliotic spine might look like. Now, the other classic signs is you've got a lot of tissue on that side of the hump, on that side of the curvature, right? There's a lot of gathered tissue right here, and that's pretty thick. And then on this side, you've got a lot of stressed tissue that's kind of pulled, okay? So these are kind of like strings. Okay, so to intervene with this, it seems a little counterproductive to me in my brain, but so I've really had to learn. But what you want to do is just get your fingers, you're on this side of the spine, and you want to get your fingers and just grab the tissue and pull it this way. Now, Russ, how much pressure am I using on you?
Not much.
Not much. It's not a deep pressure. You're only in the skin, barely muscle layer, right? So you're just gathering the tissue, and what I'm doing is I'm hooking my claws in here, and then I'm moving my spine backwards. And that's just gathering the tissue and moving it this way. And another reason why I'm not using a ton of pressure is because he doesn't have scoliosis. Okay, so just gathering the tissue and scooting it this way throughout the whole thoracic side here, okay? And then on this side, same thing. Stay where you are. You want to be on this side of the spine. You're gathering the tissue and you're moving it back up here onto the hump thing. You're moving it back. So what you're trying to accomplish is just giving a little bit of relief of this curvature, trying to encourage it to come this way, okay? So just this, yada, 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 okay? And same thing down here. You move towards the hump this way and that way. All right, so then the movement that you want to call for, you want to be on the side that has the weaker tissue. The weaker tissue meaning the stuff that's really gathered up over here. So on his side right here, I would take his arm and put it into just a very nice relaxed position right here. Gather it with your arm, so I'm kind of holding his deltoid right here in my palm, okay? Does your arm feel nice and supported? Okay, you want to line up his arm with his scapula rather than his chest, and then put your hand on his scapula. Now his scapula is being kind of pushed out of the way too from all this tissue. So put your flat palm on the scapula, your sticky palm, and then you ask your client just to press downward on your arm right here, gently. Okay, so go ahead and do that for me, Russ. And then as they're doing that, I'm just rotating the meat of the scapula back into place. And now rest. And then one more time. I like to do 3 times, depending on the time that I have. You can even just stay in this static position for a minute and then rest. But his contraction of his shoulder is encouraging all this to strengthen. Just like that. Okay, and rest. And give him back his arm. And that is intervention for scoliosis, kyphosis, and lordosis. Thank you for joining us.